We've been interested in trying to find a way to accurately diagnose Parkinson's disease. We've shown through a brain and body donation program that the accuracy of diagnosis is not always 100%, so that if you see somebody who has rest tremor, slowness of movement, gait difficulties, rigidity, early in the course of the disease, they often can progress and actually not have Parkinson's disease at the time of autopsy. They may have progressive supranuclear palsy or some other neurodegenerative disease. So diagnostic accuracy is of critical importance for patient prognosis and really critical for things like invasive type treatments. You want to have the right diagnosis, and then for clinical trials. So we have looked at peripheral tissues to determine if there's a location that we could biopsy to make a definitive diagnosis. So we know in the brain there's Lewy bodies, which are made up of alpha-synuclein, the protein clumps and aggregates. But through the brain and body donation program that we have been running, we can find alpha-synuclein, which is pathologic in the submandibular gland. We can find it in some other areas of the GI tract, but the densest location is in the submandibular gland. And so from a translational research standpoint, we took that from the autopsy data, and we have biopsied people with Parkinson's disease. And we've been able to find that individuals with PD, about 75%, have a positive biopsy, meaning that we take the tissue via a needle biopsy, and we can find pathologic alpha-synuclein deposited in those submandibular glands. A number of different studies, two from us, one from a group in Spain looking at Parkinson's disease, have confirmed that we can do that in early Parkinson's disease as well as advanced Parkinson's. So potentially use this as a diagnostic test. But what was of great interest to us was the idea, can we look at tissue biopsies as a progression marker? And in order to do that, you need to be able to look at biopsies at baseline and then follow those biopsies over time. And so the study that we reported here at the American Academy of Neurology was 7 of our patients who we had previously biopsied, we re-biopsied, an average of 4 years after their first biopsy. And of those 7, we had good tissue in all of them. All of them were positive. So they all had the alpha-synuclein deposits in their submandibular gland. And we compared it to the first biopsy. The average amount of alpha-synuclein increased in those 4 years as a group. And of the individual 7 cases, 5 of them had an increase, 1 had no change, and 1 had a slight decrease in the amount of synuclein. So we believe this is good pilot data or preliminary data to use for future studies, larger populations of patients, to try to determine if submandibular gland biopsies are the way to go in terms of determining whether synuclein treatments, there's a lot of studies here at the AAN talking about anti-synuclein treatments. How can we slow or stop the progress of PD? The best way potentially is to reduce or stop the aggregation of synuclein. Hopefully now with biopsies, we would be able to actually monitor that, so we can monitor the clinical status of the patient, and we can monitor the aggregation of synuclein in the submandibular gland.